Welcome to this comprehensive audio session on cerebral infarction, where we'll explore the intricacies of this condition, including its etiology, pathogenesis, clinical symptoms, diagnosis, and differential diagnosis. We'll also shed light on a broader spectrum of common risk factors contributing to cerebral infarction and key parts of patients' evaluation. Etiology. Cerebral infarction or stroke emerges from the interruption of blood flow to a part of the brain, causing oxygen deprivation and subsequent tissue damage. Primary causes include thrombosis and embolism. Pathogenesis. Understanding the pathogenesis is crucial. Thrombotic strokes involve blood clot formation within cerebral arteries. Limiting blood flow, embolic strokes occur when clots form elsewhere and travel to the brain. Systemic low perfusion is often linked to conditions affecting overall blood flow, such as severe hypotension. Common and varied risk factors. A comprehensive understanding of risk factors significantly contributes to our awareness of cerebral infarction. The common risk factors are arterial hypertension, diabetes, dyslipidemia, smoking. Several other factors elevate the risk. Irregular heart rhythm in atrial fibrillation increases the likelihood of clot formation, which can travel to the brain and cause a stroke. Certain cancers and cancer treatments can predispose individuals to a hypercoagulable state, increasing the risk of stroke. Conditions associated with abnormal blood clotting, such as thrombophilia, can heighten the risk of thrombotic strokes. Clinical symptoms. Symptoms of cerebral infarction remain diverse, encompassing sudden onset weakness, numbness, difficulty speaking or understanding speech, loss of vision, imbalance, loss of consciousness. The symptoms associated with cerebral infarction can vary based on the affected arteries. Strikes involving the middle cerebral artery are the most common and may lead to contralateral hemiparesis, sensory deficits, and aphasia. Infarction in the anterior cerebral artery territory can result in contralateral leg weakness and sensory loss, as well as cognitive and behavioral changes. Clotting in the posterior cerebral artery may cause visual disturbances, including homonymous hemianopia. In the vertebrobasilar system, stroke symptoms can include vertigo, diplopia, dysarthria, ataxia. Diagnosis. Diagnosing cerebral infarction involves a multifaceted approach, with clinical examination playing a pivotal role. Healthcare professionals carefully assess the patient's symptoms and neurological signs, aiding in the localization of the affected area. While various imaging studies like MRI and CT scans provide essential insights, clinical examination remains the cornerstone. The ability to promptly recognize and respond to stroke symptoms can significantly impact patient outcome. The golden standard for imaging diagnosis is a non-contrast CT scan. This modality swiftly identifies areas of infarction, assisting healthcare providers in making informed decisions about treatment and management. Important in the first hours, the brain CT may be normal, with no areas of infarction. This does not exclude an ischemic stroke, but excludes other conditions, which can mimic ischemic stroke like brain hemorrhage. Diagnosis is made on the clinical picture, and early management of these patients can lead to complete recovery. Time is of the essence in stroke management. Swift evaluation is crucial, as certain treatments, such as thrombolytic therapy, are most effective within the first few hours after symptom onset. The concept of time is brain underscores the urgency of early intervention to minimize potential damage. Calculating stroke onset. Determining the time of stroke onset is pivotal for treatment decisions. Clinically, the time of stroke onset is defined as the last moment the patient was seen normal. This information is crucial in establishing eligibility for time-sensitive interventions. Be fast for quick stroke evaluation. Every healthcare provider should be able to recognize stroke symptoms. Remembering the acronym Be Fast can aid in quick stroke evaluation and is widely used worldwide. B for balance. Sudden loss of balance or coordination. E for eyes. Sudden vision loss or double vision. F for face. Ask the person to smile and check for drooping on one side. E for arms, check if one arm drifts downward when raised. As for speech, slurred speech or difficulty speaking. T for time. If any of these signs are present, it's time to call emergency services. Stroke severity. Upon the patient's arrival, healthcare providers often use the National Institutes of Health Stroke Scale to assess the severity of the stroke. This standardized tool evaluates various neurological functions, such as consciousness, vision, sensation, and language. The total score provides a measure of the stroke severity guiding treatment decisions. A lower NIHSS score indicates a milder stroke. A higher NIHSS score suggests a more severe stroke requiring immediate and intensive intervention. Modified Rankin Scale. Beyond the acute phase, the modified Rankin Scale plays a crucial role in assessing the long-term impact of a stroke on a patient's functional abilities. This scale ranges from 0 to 6. 0 for no symptoms, 1 for no significant disability, 2 for slight disability but able to perform daily activities, 3 for moderate disability requiring some help, 4 for moderately severe disability dependent on others, 5 for severe disability, bedridden, and requiring constant care, 6 for death. Understanding a patient's modified Rankin Scale score helps healthcare providers tailor rehabilitation strategies and support services to enhance the individual's quality of life post-stroke. Importance of National Institutes of Health Stroke Scale and Rankin Scale. The NIHSS and Rankin Scale serve as invaluable tools in stroke management. The NIHSS aids in rapid assessment, guiding immediate treatment decisions. The Rankin Scale, on the other hand, offers a comprehensive perspective on the long-term impact of the stroke on a patient's daily life. Differential diagnosis distinguishing cerebral infarction from other neurological conditions is crucial. Conditions like transient ischemic attacks, intracerebral hemorrhages, and metabolic encephalopathies can present similar symptoms. It's essential to be aware of stroke mimics, where conditions like hypoglycemia or epileptic seizure can present stroke-like symptoms. In conclusion, the significance of quick stroke evaluation, symptom recognition, and precise differential diagnosis cannot be overstated. The brain is a realm where time is not just of the essence. It's the currency of potential recovery and regained quality of life. Stroke is not merely a medical condition, it's a societal challenge. Its impact ripples through families, communities, and healthcare systems. By equipping ourselves with the knowledge and skills to act decisively in the face of stroke, we contribute not only to individual well-being, but also to the broader fabric of society. In the face of a stroke, seconds matter and informed actions save lives. Let us carry forward the torch of awareness, ensuring that every medical professional, regardless of their specialization, is well-versed in the art of rapid stroke evaluation. It's a journey that begins with education and resonates in every clinical encounter. Thank you for joining us in recognizing the importance of swift and accurate stroke evaluation. Together, let's continue to make a difference in the lives of those affected by this profound medical condition.